Choking can occur when a solid object, such as a piece of food, or a small object enters a narrowed part of the airway and becomes stuck. On inhalation, the object can be drawn tighter into the airway and block air from entering the lungs. A forceful thrust beneath the ribs and up into the diaphragm can pressurize the air in the chest and pop an obstruction out of the airway. Compression of the chest over the breastbone can also create enough pressure to expel an object. To provide the appropriate care, you must first be able to recognize the difference between a mild blockage and a severe blockage. With a mild blockage, a person can speak, cough, or gag. This type of blockage is typically cleared by the affected person naturally through forceful coughing. Allow someone with a mild blockage to try and resolve the problem on his own. Stay close and be ready to take action if things worsen.
Morning, Chrissy. How are you feeling?
Much better, thank you.
Good. You need to get another set of your vital signs after you finish your breakfast.
Sure.
When a severe blockage occurs, a person cannot take in enough air to dislodge the object. Signs of severe obstruction include very little or no air exchange, the lack of sound, and the inability to speak or cough forcefully.
Chrissy?
Are you choking? I can help, okay? Stand up. Try and get a breath. Try and get a breath. Let's sit down.
A person without any air exchange requires your help to survive. If you suspect someone is choking, ask, "Are you choking?" If the person nods yes or is unable to speak, cough, or cry, act quickly. Stand behind the person. Kneel behind someone who is sitting. Reach around and locate the person's navel with your finger. Make a fist with your other hand and place the thumb side against the abdomen just above your finger and below the ribs. Grasp your fist with the other hand. Give a quick inward and upward thrust. Each thrust needs to be given with the intent of expelling the object. Repeat thrusts until the person can breathe normally. If the person becomes unresponsive, carefully lower her to the ground. If not already done, activate the emergency response protocol for the setting. Begin CPR starting with compressions. Look in the mouth for an object after each set of 30 compressions and before giving rescue breaths. Remove any object if seen. Continue care until the person starts to move or another BLS provider takes over. When someone is clearly pregnant or obese, use chest thrusts instead of abdominal thrusts. Position yourself directly behind the person. Reach under the armpits and place the thumb side of your fist on the center of the chest. Grasp your fist with your other hand and thrust straight backward. Try not to put pressure on the ribs. If you are choking and alone, try pressing your abdomen quickly against a rigid surface, such as falling onto the back of a chair. If one is not available, attempt abdominal thrusts on yourself. Young children are particularly at risk for choking because of the small size of their air passages, inexperience with chewing, and a natural tendency to put objects in their mouths. For a choking child, the approach is nearly the same for adults. It might be easier to kneel behind a choking child to deliver thrusts. Use less force on your thrusts. Because infants do not speak, it may be more difficult to recognize choking. A sudden onset differentiates it from other breathing emergencies. Signs include weak, ineffective coughs and the lack of sound even when an infant is clearly attempting to breathe. If you suspect an infant is choking, Act quickly. Lay the infant face down over your forearm with legs straddled and with the head lower than the chest. Support the head by holding the jaw. Using the heel of your other hand, give 5 back blows between the shoulder blades. Next, sandwich the infant between your forearms and turn her onto her back with legs and arms straddling your other arm. Place 2 fingers on the breastbone just below the nipple line and give 5 chest thrusts. Repeat back blows and chest thrusts until the infant can breathe normally. If the infant becomes unresponsive, gently place her onto a firm surface. If not already done, have someone activate your emergency response protocol and begin CPR. Look in the mouth for an object after each set of compressions and prior to giving rescue breaths. Remove any object if seen. Abdominal and chest thrusts can cause internal injury. Anyone who has had these maneuvers used on them should be evaluated further to ensure there are no injuries.